9 o'clock. Question, hold on, number 1. We did med-surg like a live or two ago, but we'll work it back in. We'll do a med-surg something this week. And we go live Sundays, Tuesdays, and Thursdays at 9 p.m. All right, guys? All right, I'm seeing all over the place D's, B's, and C's. So we're talking about what is the priority action here. All right? The priority action here is going to be B, okay? So administer the diphenhydramine. So this is basically what they're describing here is an acute dystonic reaction. They're talking about sudden muscle spasms, the ocular crisis. So anticholinergics like the diphenhydramine fix it fast. Okay, warm compress, cute but not helpful. C, you will notify, but first you fix the airway threatening muscle spasm. And D, well, that's for suspected NMS, okay? And so that's not this. All right, awesome. Thank you guys for sharing the live. All right, let's go. Question 2. 1, 2, 3, 4. All right. Reports diarrhea, poor appetite, and new hand tremors after starting hydrochlorothiazide. What should the nurse do first? What should the nurse do first? Already up to 1,500 likes and 135 viewers. You guys are awesome. Thank you guys for sharing, liking, and following. All right, I'm seeing C's, D's, C. Okay. B's. All right, yep, answer here is going to be C, guys. So tell the patient to hold the lithium and notify the provider. So hydrochlorothiazide increases lithium retention. All right, so we're talking toxicity here. So GI upset plus tremors equals early toxicity. Okay, A is not expected. B, yes, sodium matters, but toxicity is stop the drug and call back up. All right, D is also helpful, but not the priority before holding lithium. Okay, 3. Patient on clozapine reports sore throat and chills. The nurse reviews labs. What is the priority? Okay, I feel like I see a lot of C's. All right, yep. Hey guys, it's gonna be C here. All right, so hold the clozapine and notify the provider. So we're talking an A and C, that's the absolute neutrophil count less than 1,000, which is neutropenia, which means clozapine is done. All right, clozapine plays 0 games. So B, it's the B, protective precautions may be needed, but first you got to hold the med. All right, A, absolutely not. D, supportive, but not the priority. All right, 4. A patient with depression just started fluoxetine. Which statement requires immediate follow-up? Which statement requires immediate follow-up? Okay, I'm seeing C and D. Okay. Yep. All right. Good job, guys. Answer your majority of you are getting C. That's correct. So C is basically describing that classic SSRI danger zone. All right. Energy improves before mood, which then leads to an increased suicide risk early in therapy. All right. A, B, and D, common and expected. C is kind of that red alarm. You put your sprinting shoes on. All right. And and you gotta pick that as your answer. Okay. Awesome. 5. A patient is admitted with severe alcohol withdrawal. They are hypertensive, diaphoretic, and hallucinating bugs crawling on the walls. Which medication should the nurse anticipate administering first? If you guys have ever had a patient on CWA precautions, that's where you count their score. Usually you give this medication, if their CWA is usually above 8. Okay? And the majority of you are selecting the right answer. And the right answer is B, lorazepam, otherwise known as Ativan. And lorazepam is a type of benzo. And they are the kings and queens and royal court of alcohol withdrawal. Okay? A and C, those are antipsychotics and actually may worsen the seizure threshold. And D, the naltrexone, is like for long-term relapse prevention, not for acute withdrawal. Okay? 6. All right, the nurse is caring for a patient with borderline personality disorder who suddenly states, "You're the only nurse who cares. Everyone else here is useless. What's the priority therapeutic response?" What is the priority therapeutic response, guys? Therapeutic communication. Oh boy. All right. So I feel like you guys want to jump into the, let's keep you talking. But the correct answer here is C. Correct answer. So what are they doing right now? The borderline personality, what is that word that this person is trying to do between you and your team? They are, Elizabeth has it, splitting. Okay? That is what people, so if you see a question with borderline personality disorder and they're talking like this, they're trying to split you guys. All right? So you must, in this moment, depersonalize and reframe as a team approach. All right? So A falls right into the splitting trap. B encouraging feelings is fine, but you must correct the split first. All right, and obviously it's not D. Okay. All right. 7. All right, a patient on MAOIs eats pepperoni pizza and drinks red wine. Which symptom is the priority concern? Okay. Yep. All right. This one's a gimme, I think. Answer C, severe headache, elevated blood pressure. So we're talking about MAOIs, plus they're putting pizza and red wine, which is tyramine. Do you remember that from your pharm class? So MAOIs plus tyramine equals a hypertensive crisis. All right. Yeah. So B, it could hint serotonin syndrome, but here the trigger is tyramine. Okay. All right. Thank you guys for the follows, and thank you guys for sharing the live. Much appreciated. All right. A patient on olanzapine has gained 18 pounds in 3 months and has a fasting glucose of 158. What's the nurse's best action? All right. Thank you guys again for sharing the live and following. Again, we do these live Sundays, Tuesdays, and Thursdays. So you can definitely choose to follow. And then on my page, there's a little bell on the top right of the screen on my main page where you can choose to be notified of when I go live. Okay. All right. So the best action here is going to be B. Okay. The correct answer is going to be B. Request a switch to aripiprazole. So olanzapine basically can cause it's a form of like metabolic apocalypse, okay? The aripiprazole will lower the metabolic risk. So A, while that's helpful, it's not sufficient when metabolic syndrome is brewing. And C, harmless, well, not with insulin resistance. And D, never abruptly stop any kind of psychotic, okay? Awesome. Thank you guys for all the follows and sharing the live. Fantastic. We are just trying to get you guys across this finish line. Bree, this line is for everybody. I mean, mainly there's going to be a lot of RN stuff, but yeah, but there will be some PN overlap when we just talk about pharm stuff. All right, what is the nurse's best response here? All right, correct. Majority of you are saying B, which is the correct answer. So buspirone takes 2 to 4 weeks to begin working. So buspirone, slow, steady, and boring. Okay, there's no sedation, no dependence, no instant gratification. So if your patient is being prescribed this, you gotta let them know, hey, 2 to 4 weeks. Oh, I like that. Bus equals slow because the bus is generally pretty slow. So buspirone is slow. Okay, so A is dangerous, C is just not appropriate without evaluation, and D, the dose won't fix the time-dependent mechanism there, okay? All right, so 10. A patient with PTSD is experiencing a flashback and begins screaming, "Get away from me." Which intervention should the nurse perform first? Which intervention should the nurse perform first? All right, awesome. Thanks, guys, for liking the live and sharing the live. I much appreciate it. Okay. All right, looks like the majority of you are jumping on C here, which is the correct answer. Good job. So maintain a calm voice, ensure physical distance. So safety here is the priority. So you're grounding without invading their space. Okay, good job. I don't think that one needs too much explanation. All right. 11. All right, looks like we've got some answers coming in. You can only pick one. There's no. This is not a select all that apply. All right. Looks like I see A, B, and C with the majority of you. I think leaning B, and so B is going to be the correct answer here. All right. So what this question is describing are the classic signs of tardive dyskinesia. All right. A potentially irreversible movement disorder. All right. It's caused by prolonged dopamine blockade. So the priority is stopping the offending agent here and contacting the provider to switch to the lower risk antipsychotic like, clozapine. Okay. All right. So A, benztropine treats acute dystonia. Okay, not TD. And TD, C for C, TD is not acceptable or expected. And D, increasing dopamine blockade is going to worsen the TD. So there you go. Answer is B, hold the medication. All right, 12. Here we go. A patient taking sertraline 100 milligrams daily arrives at the clinic sweating. Anxious and reporting abdominal cramping. They say my muscles keep jerking and I feel like something is buzzing inside me. Which additional finding would inform a life-threatening condition? Yeah. Okay. Yep, majority of you, I think almost all of you got this so far. Well, so yeah, we're talking about B here, guys. So hyperreflexia and clonus. So these neuromuscular signs are strongly indicating serotonin syndrome. All right, especially when paired with agitation, tremors, and autonomic changes. All right, so A, mild hypotension isn't diagnostic. Okay, C, mydriasis is nonspecific, and D, we're talking low-grade fever doesn't really reflect the hypothermia typical of serotonin syndrome. Okay, so there you go. 13. A patient hospitalized for acute mania is prescribed lithium. Morning labs show lithium 0.7 and sodium 128. The patient is pacing, talking rapidly, refusing meals, saying, I have too much energy for food. What is the priority action? What is the priority action here? Yeah, I think you guys are jumping over this one. Absolutely. So yeah, the answer is going to be D. Notify the provider about hyponatremia. So low sodium is going to increase renal reabsorption of lithium, all right, which places the patient at a very high risk of toxicity. All right, even with a normal current level. So this is, a safety critical finding. Okay. So while the lithium is normal, the sodium is not. And when the sodium is not, that increases the risk of lithium toxicity. So if you see a question that has lithium and sodium in the question, they are like this, okay? So that sodium has to be within a normal range, okay? You need to fix it. All right, 14, a 29-year-old taking valproic acid for bipolar disorder reports increasing fatigue, persistent nausea, vomiting, and right upper quadrant pain. They appear jaundiced. Which lab result supports the suspected complication? I do not do one-on-one tutoring. This is what I have time for right now. Beba. But I do offer custom study plans. The custom study plans are available in the link in my bio. They are $25, but that's just because it takes me some time to do them. All right, we can talk more about the study plans here in a bit. So 14 is going to be C, right? So we are talking about the elevated AST and ALT. Essentially, these symptoms in the question are pointing towards a valproate-induced hepatotoxicity. All right, so especially when the hepatic enzymes increase. So A, we're talking in A, the elevated amyloid suggests pancreatitis, not liver injury. B, the valproate more commonly causes low platelets. All right, and D, the sodium is not relevant here. Okay. All right, 15. Come on. Come on, 15. There you are. All right. Patient receiving high dose haloperidol for acute psychosis suddenly becomes extremely rigid, diaphoretic, tachycardic, and febrile. They are minimally responsive. Which treatment should the nurse anticipate first? Which treatment should the nurse anticipate first? All right, I'm seeing C's, D's, A's. Holy moly, you guys are like all over the place here. Okay, all right. Okay, so we're gonna jump into the answer. So you guys are totally split here. All right, so the answer is C, dantrolene and bromocriptine. All right, so these symptoms, somebody asked it in the chat, what's the difference? Or what does neuroleptic malignant syndrome look like? Well, this is it. This is the neuroleptic malignant syndrome. So the treatment requires immediate stoppage of antipsychotics and administration of dantrolene. Okay, that's the muscle relaxant, and bromocriptine, which is the dopamine agonist. Okay, so for A, lorazepam does not reverse NMS pathophys. Okay, B, the benzotropine treats acute dystonia, not NMS. Okay, and D as well, it's just supportive care. It's not sufficient. Okay? All right. 16. All right, so yeah, definitely look up and compare serotonin syndrome and neuroleptic malignant syndrome. Okay? All right. Okay. Yep. All right, majority of you are saying C. That's going to be correct. Encourage continuation. So SSRIs for OCD require 10 to 12 weeks for meaningful improvement. Okay, 8 days is just too early to gauge effectiveness. Okay, we're going to jump through a couple of these next ones here. We're just a touch behind schedule. That's all right. We're 22 minutes in and on question 17. All right. All right. What is the nurse's best response? Let's go. You guys got this. Okay. Yeah, here we are going to get them to keep talking, right? All right, so, yep, answer is B. Okay, it acknowledges their experience, without reinforcing or challenging the delusion. And it allows assessment of the distress, the risk, and the thought content. Okay, yeah, A is real rude. Okay, that is so rude. Really fucking rude, right? So don't do that. Don't make promises. Okay? All right. Very good, guys. Very good. 18. All right. A patient who recently started the methylphenidate reports new chest pain, shortness of breath during mild exertion, saying, "My heart feels like it's pounding out of my chest." What is the priority action? What is the priority action? What is methylphenidate? Oh, somebody said this is an ADHD med. Okay. Yeah, guys. So B is the answer. Hold the stimulant and assess vital signs. So, right, the rationale is stimulants can precipitate cardiac ischemia, all right, arrhythmias, or hypertension. So chest pain plus shortness of breath, we need to do an immediate assessment and withhold the medication. Okay? Very good. I think pretty much everybody got that. Okay. A patient with major depressive disorder calmly states, "I gave away my dog yesterday, and I've arranged all my payments for the next year. I feel at peace now." What's the nurse's interpretation? I swear to God, if you guys don't get this wrong. Don't get this wrong. Don't make me boot you. Okay? Don't make me boot you. All right. I'm not going to boot anybody. Yes, guys, absolutely. It is B here. All right. So giving away your possessions, tying up all affairs, those are all final preparations. All right. High risk suicidal indicator. Okay. Good job. Those are gimmies on the NCLEX. Okay. Here we go. Quantity 3. Thanks for sharing the live. And thank you guys. Stephanie, thanks for following. There's been a couple other follows. We do these lives every Sunday, Tuesday, Thursday at 9 p.m. Eastern. So go ahead, if you're just sitting in there or on the For You page, jump in, go ahead and follow, come back, whatever you want to do. All right. Thank you, guys. Thank you. All right. What requires urgent follow-up? All right. So the one that requires urgent follow-up is B, okay, the akathisia. So this is extremely distressing, strongly associated with increased suicide risk, requiring prompt treatment like beta blockers and dose change. Okay, so A is common, non-serious. C is an expected side effect. And D, nausea is mild and manageable. Okay, all right. I can't even break that word. Yeah, right? Seriously. All right, 21. A patient on phenelzine complains of sudden, severe, throbbing headache after eating at a new restaurant. They look flushed and anxious. What is the nurse's first question? What is the nurse's first question? Yeah, we had a question that was like this with red wine and pepperonis mentioned earlier. Right. So what's that? We're assessing for, what's that word? That T word? We're assessing for their blank intake. Okay. That's, somebody drop it. There it is. Danielle, Maddie, Shanor. Absolutely. It is we are assessing for tyramine intake. So we are talking about B. The answer is B. All right. So this presentation is classic for a hypertensive crisis due to an MAOI plus tyramine interaction. Okay. Not thymine, tyramine, spicy RN. Ow, got you. Spicy. Ignore me. Ignore me. All right. 22. All right. Patient withdrawing from benzos develops tremors, severe agitation, elevated BP, visual hallucinations of insects crawling on the walls. What requires immediate intervention? All right. Yeah. Why this one's so easy? And just wait. They're not all this easy. Okay. Yes. Literally says dangerous BP elevation. Okay. If anybody puts anything else, we're going to have issues. Okay. So, yep, answer C. They're talking about autonomic instability with hallucinations. They're like on the borge, the borge. They're on the brink of having a seizure or delirium tremens, something like that. Okay. All right. So that one was easy. 23. Patient taking bupropion for 5 days reports, I haven't slept in 2 days. My thoughts are racing. They speak quickly and appear euphoric. What is the priority action? Yep. Yep. All right, good job, guys. Majority of you are saying, well, there's a lot of B and there's a lot of D. Answer here, I thought was going to be pretty straightforward. It's actually B, guys. So, all right, B, hold the medication. Bupropion can precipitate mania, okay, in bipolar patients specifically. So racing thoughts, decreased need for sleep is like an escalating mania. So D, timing, if you do scheduling it earlier in the day, is not going to stop the mania. Okay, so we need to hold the dose and notify the provider. All right, 20. Oh, that looks like I skipped 24. All right, 25. A long-term benzodiazepine user abruptly stopped their medication. Is that a good idea? No. They report feeling shaky and strange. What education is most urgent? Yep. All right. Another gimme. Another gimme. We had some other harder ones earlier. They'll get, we'll have some more hard ones, promise. So yeah, B's the answer. Benzo withdrawal can be fatal, can cause seizures, hallucinations, autonomic instability. Okay. So we're going to tell them not to do that. 26. All right. A patient on quetiapine reports extreme drowsiness, dizziness when standing. BP is 84/50 and heart rate of 110. What is the priority? All right. So the majority of you are saying, well, right now the majority is saying D. So that is actually going to be incorrect. We are again going to here hold the medication and notify. So this medication causes orthostatic hypotension due to alpha blockade. Okay. This BP requires immediate safety action. All right, B doesn't address the cause. C, hypotension is not expected to this degree. And D, slow movements don't solve the underlying danger. Okay, so that's why we are holding this one. Okay, a patient on amitriptyline reports blurry vision, constipation, and difficulty starting the urine stream. What should the nurse assess first? Flora says, I changed my answer. All right. What should the nurse assess first? Okay. Seeing lots of B's, a few C's, A's, and B. Okay. So yeah, answer here, guys, is in fact B, whether they can fully empty their bladder. So, so these meds, amitriptyline, the TCAs, can cause strong anticholinergic effects. So urinary retention can lead to acute bladder distension, which will need assessment. Okay. A, constipation is concerning but less emergent. C, the functional impact is secondary. And D, supplements don't cause acute retention. All right, so that's why it's B. 28. Here we go. Patient scheduled for ECT has pre-procedure lab showing a potassium of 5.8. They are NPO and mildly anxious, but otherwise stable. What should you do? I swear, every live we have a potassium question, at least one, because I need to know if you see potassium on the NCLEX, are you going to fix it? Sorry to get up close and personal in your business. Okay? All right. Yes. We're going to address it. All right? It is B. Okay? All right. So, the sucks that they use during the ECT increases potassium. So, you need to fix it, okay? Yasmin's like, I'm not even in the medical profession, and I knew that. You bunch of dummies. I'm kidding. All right, so risk of fatal arrhythmias, yeah. So, A is unsafe. C, anxiety is not the priority. D, hyperkalemia matters even without symptoms, okay? All right, good. 29. All right. What's your answer? Okay. Looks like the majority of you are saying B, and that's correct. So position and assess hemodynamics. So this one, the disulfiram, also called antabuse, can cause dangerous hypotension and cardiovascular collapse. Okay, so you need to assess circulation immediately. A, the vomiting is going to be secondary. C minimizes a potentially lethal reaction. And D, fluids don't replace assessment in this acute instability. Okay? All right. Good job. 30, a hospitalized patient with schizophrenia becomes mute, stares fixedly at the wall, maintains rigid posture for long periods, and refuses meals. What is the priority action? What is the priority action? Come on. Come on, smarty pantses. You're like, oh, this is so easy. What is it? Oh, okay. There's some A's, some B's. Oh, Yasmin. Is it B? Is it B? Okay. The answer is B. Okay. So they're basically describing catatonia, which typically responds pretty rapidly to lorazepam, otherwise called Ativan, which will improve their mobility, eating, and responsiveness. Okay. So with A, they cannot eat until their symptoms improve. C, the nutrition matters, but not before treating the cause. And D, restraints are not indicated. Okay? All right. Irene, the psych nurse. Oh, you joined the right live because we're doing all psych shit, all 50 questions. All right? Let's test Irene's knowledge. Irene, if any of these people have questions, oh, Francesca, okay. Clock that shit, girl. Okay. So Irene and Francesca, they're going to answer all your questions in the chat, okay? They're going to be our moderators for this discussion. All right, here we go. 31. All right, here we go. I feel like I want to crawl out of my skin. These are just the voices I hear. These people say, I just feel like I want to crawl out of my skin. They're usually country voices. I'm not sure why they're country voices. What is the best initial intervention here, guys? Francesca says this is EPS. Well, then what's your answer, Francesca? All right. So, answer here is going to be B, administer the propranolol. Okay, so yes, they're experiencing akathisia, so a distressing extrapyramidal symptom characterized by internal restlessness. Beta blockers like this are first-line treatment. Okay? All right, so for A, no. Increasing dopamine blockade is going to worsen the issue. C, relaxation is not going to touch it. And D, restraints do nothing. All right, yeah. All right. Sounds good. Yasmin, see you later. All right. I think I lost my spot. Here we are. What were we at? 31. Sorry, I got to jump back into the middle of these. 32. Okay. Here we go. The last question for number 31, the answer was administer the propranolol, which was B. All right. This can be used as a review for nursing school, especially if you're in a psych class. But yeah, these are, I think the majority of the folks in here, majority anyway, are probably studying for the NCLEX. Okay? Okay. So the priority action here, majority of you are saying B. That is going to be the answer. So we're talking about an absolute neutrophil count of below 1,000, which is our indicator for neutropenia, which indicates that extremely high infection risk. So clozapine must be stopped immediately. Okay, that's the answer. That is the answer, 33. All right, patient undergoing alcohol withdrawal becomes increasingly agitated. BP elevated, tremors worsen, they begin tactile hallucinations. What medication should the nurse anticipate? We had a very similar question to this earlier. Let's see if you guys get it. Okay. Let's see if you guys get it. Jennifer says B. Kim says A. Cardi says A. Jeez. Okay, so we're gonna take a ride on the Ativan. Okay, lorazepam. B. So benzos are the gold standard when we're managing alcohol withdrawal. So they're describing alcohol withdrawal, and we measure that in the nursing field with a CIWA score, C-I-W-A. And if their score is above like an 8, we're going to give them a little Ativan. If it's above a 10 or 11, we're going to give them a little bit more Ativan. Okay, so those are the gold standards. You'll see Ativan and Valium. Okay, the answer is B, lorazepam. Okay, good. 34. Patient with PTSD suddenly begins screaming, crouching under furniture and yelling, he's here, he's here. They refuse touch and appear terrified. What is the nurse's priority action? What is the nurse's priority action? Okay. Yeah. Right, this could be a potentially dangerous situation for the nurse. So yeah, we are going to C, maintain distance and orient calmly. So when these people are having an active flashback, the goal is safety. Okay, the goal is safety. Gentle orientation, all right, without any sort of physical touch. Okay, that could worsen things. So A, right here, the logic does not break through these flashbacks. It's not going to work. B, loud voices are going to escalate fear. And D, trauma exploration should never occur during a crisis. Okay? To prevent seizures, it was Ativan and Valium. All right, 35. A patient taking lithium reports new vomiting, diarrhea, poor coordination, and slurred speech. Lithium level results are pending. What action should the nurse take first? Yeah, guys, this is low-hanging fruit here. Okay. If we're showing signs of lithium toxicity, we need to prioritize holding the medication. Okay. Hey, thank you guys for all of you for sharing the live just now. Appreciate that. So yeah, we need to hold the lithium and assess for dehydration. All of these symptoms are pointing towards early lithium toxicity, which are often precipitated by dehydration. So stopping lithium and evaluating the fluid status prevents worsening. All right, it's not C because waiting risks progression of the lithium. So basically, when you see that, okay, C basically assumes that they're still taking the lithium. Okay, so if one answer is hold it, not give it, the other answers assume, well, I'm going to continue giving it, but I'm going to, just encourage fluids or provide a salt restriction. We're not going to, okay? You wouldn't want to give them more, exactly. All right. Thank you guys for all the follows. Fantastic. Much appreciated. If you guys aren't already following, you can go ahead and follow up here. We do these lives Sunday, Tuesday, and Thursday at 9 p.m. Eastern time. Okay? It's not always psych. It's usually a variety of NCLEX questions. Today, I had actually posted a video on my story asking for comments on 2 subjects that people wanted to see in tonight's live. And so psych and pharm were the ones that won out. So I'll probably do that more in the future. So you guys do have a say in what we do and what I do. There's no we, it's just me. There's no team here. Okay. Thank you guys for the follows. What is the priority intervention here? I don't think we have a majority answer yet. Although I'm seeing a lot of B's right now. All right. And yes, the answer here is going to be B. Okay. Prepare for the cryoheparin administration. So the patient here, again, these symptoms, we're talking about agitation, diaphoresis, hyperreflexia, and increased temp. We are talking about serotonin syndrome, okay, triggered by an SSRI. So SSRI plus tramadol. So the cyproheptadine, which is a serotonin antagonist, is indicated here. All right, for A, NSAIDs don't treat serotonin syndrome. C, cooling helps, but isn't the definitive treatment. And D, decreasing the dose doesn't stop the syndrome that's already in motion. Okay? All right, good job. 37. A patient with bipolar disorder is taking carbamazepine. They report fever, oral ulcers, and a widespread rash. CBC shows a white blood cell count of 2,900. What is the nurse's priority action? Gimme, guys. It's a gimme. All right. All right. Good job. Yep. The answer here is, in fact, C. All right. We are going to hold the med, notify the provider, because we are talking about findings that suggest sort of aplastic anemia or Stevens-Johnson syndrome. All right. These are 2 life-threatening complications caused by carbamazepine. All right. So for the others, A, monitoring alone is unsafe. A cream doesn't fix life-threatening reactions. And D, sun protection is just irrelevant here. Okay? So that is why the answer is the answer. So good job to those who got it. The others, do better. All right. A severely depressed patient on an SSRI reports a new onset insomnia, increased energy, impulsive spending over the last 48 hours. They deny suicidal thoughts but appear euphoric. What is the priority action? How are you guys already reading the question and answering? I haven't even read the question yet. All right. Brian, thanks for the follow. Yeah, you guys are... Yeah, these are going to be similar questions to the NCLEX. That's what this whole thing is set up like. Some of these are easy. I don't know that they'll ever be that easy, but something like this that have like more detail in the question. NCLEX questions are traditionally pretty long. There's a lot of detail, a lot of random shit to sift through. Okay. So, do you mind sharing? I create this question bank. This is created by me. This question bank lives nowhere else but with me currently. All right, so the answer is going to be C, notify the provider. All right, we're talking about possible mania here. So SSRIs can precipitate mania in patients with underlying bipolar disorder, especially when energy rises before the mood stabilizes. We had a question similar to this early on. So, A, money management isn't the issue. B, changing timing is not going to fix it. And D, relaxation doesn't treat hypomania. Okay? All right. Awesome, guys. And thanks for answering questions of your peers in the chat, because I just do not have time to get to all of them and get out of here on time for y'all. I respect your time. Told you it'd be an hour. All right, a patient receiving ECT is confused, disoriented immediately post-procedure, repeatedly asking, "Where am I?" What is the nurse's priority response? Yeah, all right, good job. Okay, so yeah, good job, guys. The answer here is C. Oh, no, I'm sorry. The answer here is B, excuse me. Provide reassurance and orientation. So when we're talking post-ECT, confusion can be expected. It can be a normal side effect. All right. So we need calm reassurance and orientation, all right, are appropriate interventions. So why the others are wrong here. So A, just isn't an emergency. C, detailed explanations are going to overwhelm this confused patient. And ambulation in D is just unsafe until they are fully alert. Okay? All right. And yep, thank you guys for answering other people's questions. Appreciate you. All right. A patient taking olanzapine has gained 22 pounds in 3 months, has a fasting glucose of 165, reports constant thirst. What is the nurse's best action? All right. Yeah, psych med, there's a lot of like psych meds in general are pretty serious meds. Like when things go wrong, they go wrong. And so, yeah, there's quite a few notify the provider questions with these types of meds specifically, because they can lead to very serious side effects. All right, so here the answer is going to be notify the provider based on the answer choices available to you. So A, lifestyle changes aren't enough. Okay. C, these changes are harmful. And D, timing with meals doesn't reduce the metabolic effects. Okay. All right. 41. All right, we got 10 more, guys. So those who are joining, we're going to 50, and we're doing normal glucose levels are 70 to 100. All right. So we do these live Sunday, Tuesday, Thursday at 9 p.m. Eastern. If you haven't already, you can go ahead and you can follow up here. On my page, there is, if you go to my profile page, there's a bell at the top right. It'll be somewhere up in that area where you can choose to be notified of when I go live. So that's an option. All right, majority of you are pounding C here on 41, and that is the correct answer. So we are going to teach about rebound anxiety and dependence. So alprazolam has a short half-life. Okay, it can lead to rebound anxiety, intolerance, and dependence when misused. Okay, for A doesn't address the unsafe behavior, B is incorrect and dangerous, and D, herbal tea is just not treatment. Okay? So, good. All right, and let's see, 42. A patient on long-acting injectable risperidone reports feeling dizzy and faint when standing. BP's 88/48. What action is a priority? What action is the priority? Okay. A's and C's here. A's and C's. Yep, BP is too low. That would be correct. All right. So, majority of you are saying C being the priority action, and I would say that that's correct. So, answer C. So, risperidone can cause orthostatic hypotension, and the BP here is going to be clinically significant, which would require some sort of provider notification. A doesn't address the severity. So while, yeah, like when we are dealing with a patient who has orthostatic hypotension, we're going to tell them to change position slowly. It just doesn't fix or address what's going on here. Okay. So yeah, answer C. Okay. Good job, Wilfrey. 43. A patient with schizoaffective disorder becomes suddenly mute, refuses to move, maintains rigid statue-like posture, is vital stable. What is the priority intervention? We had this question earlier. If you've been sticking around, worded a little differently. Okay. We are describing catatonia. Okay, those are the symptoms that she's prescribing, and the medication that we are going to give for that is Ativan. Okay, and Ativan is a type of benzodiazepine. Okay, and so catatonia usually responds pretty swiftly to benzos. Okay. All right, it's not D. Okay, antipsychotics can worsen the catatonia. All right, so don't do that. Don't do that. That's bad. Okay. A patient recently started on buspirone for GAD, says, I took my first pill this morning and I'm still anxious. This medication doesn't work. What's the nurse's best response? All right. Yeah. Again, I have a couple similar / repeat questions in here because they're important. All right. And I want to make sure even the people that join later see them. So yeah. All right. Somebody said earlier, bus equals slow, like buspirone equals slow because it's slow to start. Okay. So when you see buspirone, you have a question that ties to its therapeutic effectiveness. Okay, it's going to be slow. It's going to be 2 to 4 weeks. So if they're like, why am I not being fixed? You know, to tell them and educate them, hey, this is going to take 2 to 4 weeks. So chill the fuck out. Okay. All right, cool. So that's the answer. All right, 45. Here we go. Home stretch, y'all. A patient taking fluoxetine in St. John's ward develops anxiety, tremors, sweating, and hyperreflexia. What should the nurse do first? I try to get these lives downloaded, recorded, and posted onto my my YT. Okay, at Nurse Jimmy Official over there. I have a few on there. I've just not been super great about getting the last ones over there, but I will try to get to that this week. Okay. All right. What do we got? Majority. There's no majority answer yet. TikTok has not told me that there's a majority answer. You guys must be all over the place. But all I see are C's. So, all right, 45. Answer, yes, is going to be C. Absolutely. So we're talking about fluoxetine, St. John's wort, and they have all these symptoms going on. So you're combining remember, when you're combining an SSRI with St. John's wort, you can trigger serotonin syndrome. All right. So this needs to be addressed ASAP. ASAP, okay? So for A, documentation without action is unsafe. B, education comes after the emergency. And D, hydration does not treat serotonin syndrome, okay? Just doesn't do it. Doesn't do it. All right. 46, a patient with schizophrenia on flufenazine reports new muscle rigidity, tremors, shuffling gait. They have no fever. What should the nurse do? What should the nurse do? Oh, all right. I think hopefully you guys are picking up on some important themes in these questions. Yep. So, answer here is A. Okay, administer benztropine. So these are signs of drug-induced Parkinsonian, and it's a type of extrapyramidal symptom that responds well to the anticholinergics. For B, increasing the dose is going to worsen symptoms. C, warm packs don't treat the EPS, and D, range of motion does not fix dopamine blockade, which is what is going on here, okay? Dopamine blockade. So if you have a piece of paper and you're like, jotting down themes, okay? Dopamine blockade, serotonin syndrome, NMS, neuroleptic malignant syndrome. All right, these are things that you should be following up on when you leave here. Okay. A patient with depression is prescribed amitriptyline. Which patient statement requires priority teaching? Which patient statement requires priority teaching? Okay. Letting a few more answers roll in here because I do not feel like there's a consensus. All right, there we go. Majority of you are saying C, and that's going to be correct. The C, heart racing. So amitriptyline can cause cardiac conduction abnormalities. Got it? Palpitations may indicate that there's some sort of arrhythmia risk. So we need to investigate that further. Why the others are wrong. So for A, sedation is expected. B, that's the correct medication timing. And D, hydration helps. Hydration helps with anticholinergic effects. Okay? All right. Okay, 48. All right. Thank you guys for the follows. We are about to wrap up here soon, but if you haven't already, you can follow up there. Again, I have lots of NCLEX review content on my page. I have a whole 30+ part playlist. Plus, we have these lives, which I do Sunday, Tuesday, Thursday at 9 p.m. Eastern. Okay. And then I offer a couple services. I do custom NCLEX study plans. And if you are interested in just learning a little bit more about that, stick around here, okay? So 48 is going to be B, avoid those over-the-counter cold medicines, okay? So those over-the-counter decongestants may contain some sympathomimetics, which can trigger hypertensive crisis with MAOIs, okay? Sympathomimetics. Yeah, that's the name of those over-the-counter meds. Well, that's what the name of some of those ingredients that they can, over-the-counter decongestants can contain, is sympathomimetics. Okay, and they are bad with MAOIs. Get it? Got it? Good. All right, 49. A patient on lithium has level 2.1, they're confused. Have slurred speech, coarse tremors, and severe diarrhea. What is oh my God, guys. If you picked the wrong answer, you're not allowed back in. You're not allowed back in my life. Don't do it. Don't do it. I'm what? Look at my eyes on the chat. I'm watching the chat. I've been told I have long eyelashes for a guy. What do you think? Huh? Oh my gosh. Thank you. Obviously D. Obviously D. Okay? When, not a nurse, but D seems obvious. You're poking my nose with your face. All right. So, absolutely. We're going to hold that shit. Yeah. Okay. All right. Here we go. Here we are. Okay. We've made it. A patient on paroxetine abruptly stops taking it and reports irritability, dizziness, electric shock sensations, and nausea. What is the nurse's best response? All right. For B, for 50, majority of you, yep, are saying B, right? This is withdrawal. You need a supervised taper, 100%. This is SSRI discontinuation syndrome. So especially common with those short half-life drugs like paroxetine. So you need a gradual taper to prevent further symptoms. All right, guys, stick around. All right, don't go anywhere. Again, hey, here's my face. I'm Jimmy, and I'm an ER nurse and also part-time NCLEX coach here. So we do these Sunday, Tuesday, Thursday at 9 p.m. Eastern. If you are studying for the NCLEX, the biggest thing that I could do for you, other than doing these lives, is helping you with creating a NCLEX study plan, which is a service I offer. You can go to the link in my bio, and there's a link there to fill out some questions and then shoot it over to me. It is $25 only because these are customized to you, your time, your resources that you're already subscribed to, whether you're using Archer or Boot Camp or Simple Nursing, yada, yada, yada. I can tailor it to that so that you're not paying for anything else. And then if you're a repeat test taker, so it includes your CPR into the study plan. So definitely, if you're, I feel like when I took the NCLEX the first time, I failed, and it was just because I didn't have a good structure in place. I was just kind of all over the place, kind of dabbling in, I got a ATI book that I tried to work through myself, and I listened to the Mark K lectures, and it just did not work for me, and I could have used a little bit more structure. So, yeah, if you're interested in that, it's there. It's in the link in my bio, and you can request that, and I usually get those back within 24 to 48 hours, usually earlier, okay? Usually closer to the 24-hour mark, okay? And let's see. And also in the link in my bio is the NCLEX Vault, which is free, okay? It is totally free right now, and all it requires is like your name and email. So that's there. It's right below the study plan link. Thank you guys to all the regulars, all the OGs in here. Don't think I didn't see you guys. So yes, thank you guys for joining. Much appreciated. I wish you guys all the best. This is hard. This is really hard. Nursing school is probably one of the hardest things you will ever do, especially up to this point in your life. So definitely just keep plugging along. I guarantee everybody in this chat will be a nurse 100%. All you have to do is keep going. All you have to do is keep going, okay? It's not like, all right, nursing school is hard for a reason, all right? It punches you in the gut for a reason, because what you're doing is you're trying to do something meaningful, all right? And meaningful things aren't easy. They are hard, okay? They will make you question that, they will make you question if you're doing the right thing, if you're on the right path, if you should just quit. Yeah, sometimes it can be humiliating. But honestly, I wouldn't change a thing. So keep going. Just keep going. Okay? Just keep going. You will get to the other side, I promise. All right. And any failed class or I didn't pass the NCLEX, okay? It's just a detour. If it happens, it's just a detour. It's not your final destination. You will get there. Just stick with it. Keep grinding. All right. I'm here to help as much as I can. And again, I would recommend to all of you, if you're interested in a study plan, I can help connect those dots for you. I see Fiona in the chat. She got her study plan about a week or so ago. All right. Nope, there's no other options to contact me. I don't give out my phone number or anything like that. You can send me a DM through TikTok, but that is it. Okay. So that being said, I have not gotten to a workflow that makes sense to give out the study questions. I'm working on something, but it's not fully cooked out yet. Okay. It's not fully there. There is some, I feel I'm excited about, there's some exciting updates on the horizon, but not just yet. Okay. I would leverage your current resources. AI is a great thing. You can use that to help create study questions and stuff like that too. So check out that. And again, if you need anything, send me a DM. If you want a study plan, it's the link in my bio. And that's pretty much it. Okay, the NCLEX Vault is there as well. 236 pages of cheat sheets and mini quizzes there. So yeah, I have a whole psych and pharm section, and each of those sections has a 25 question mini test afterward. Again, it's available in the link in my bio. Okay. All right. So to the 196 of you that are still here, I am heading out. I need to go to bed. Next session is, I do this every Sunday, Tuesday, and Thursday, 9 p.m. Eastern. Sunday, Tuesday, Thursday, 9 p.m. Eastern. Okay. All right, guys. Take care. See you soon. Bye-bye.